and age of the patient.
What? I missed it. What you say now?
Other risks.
So I would, right?
Yes. Technically, yes. Other risks for pressure ulcers developing, besides the main two, going to be a cause of the main two, then these are going to be one of the factors behind one of the main two. It's going to be immobility, nutrition, hydration, skin moisture, mental status, and age are going to be directly related to one of the two factors, either external pressure or friction and shearing of the skin. Those are going to be directly related. Also, on page 931 in your Taylor, box 32.2, are risk factors for pressure ulcers developing. You need to know that, like diabetes and fractures, incontinence, dehydration, skin hygiene, poor circulation, previous pressure ulcers. So they're saying if you had one previously in a certain spot, you're more prone to get one again in that same exact spot than normal, okay? Now, I'm not going to go, we could go into the immobility and the nutrition and all of that, but you can do that on your own reading. That's not very important. You know that moisture causes skin breakdown. Poor nutrition causes, not enough nutrition in your skin, and that causes what? Narcosis. All of that, okay? Now, the stages of pressure ulcers. The first indication that a pressure ulcer may be developing is blanching, and that's becoming the pale and whiteness of skin over a certain area under pressure. You know when you do your assessments and you do the capillary refill, when you press on the nail and it becomes white and all clear, that is, if you see that on a patient, that is the first sign of a pressure ulcer. And when you release, it becomes just blood red. That's the body reacting and sending out an abnormal flow of blood to that certain area to get the oxygen levels and all of that back to where it needs to be. Okay. With the stages, there are 6 stages actually.
4 and that's me.
What? Say it one more time. There's 6 stages. There's 4 that are numbered and 2 that are not. Okay. What's the first stage? It's not numbered.
The first stage is not numbered. Deep tissue. No.
It's suspected.
Suspected deep tissue.
No, it's just suspected.
Yeah, that's it. Suspected deep tissue.
Okay.
Yeah.
Yeah, it's something that is suspected. You're inspecting it, and you see something that's abnormal, and you just suspect it. Stage 1, stage 2, 3, 4, and then unstageable. Unstageable is usually it has the eschar over it, so you really can't see how deep or what, because it has that scar over it, that black. Yeah, and then you have to debride in order to actually stage it. Stage 1 pressure ulcer is an area where there's intact skin, non-blanching redness on a localized area, usually over a bony prominence. That's for stage 1. Now, stage 2 pressure ulcer involves partial thickness loss of the dermis and presents to stage 3. So stage 2 is loss of your dermis, and it's gradual, so it's going to directly flow into stage 3. So usually stage 2 and 3 are really, really connected because it's going to be a fast process between those two. Stage 3 is the full thickness tissue loss, and then you can see the subcutaneous fat. So it's going to be all the tissue of the skin gone, and you're going to see the meaty like fat, the yellow tissue underneath it. And then in the stage 4 ulcer, it's where full thickness tissue loss and the bone is exposed, the tendon or the muscle. So this is where everything is going to be exposed. You're going to either see the muscle, the bone, or the tendon, and that's a stage 4. That's really, really deep. Also, you can have the tunneling and all of that within the actual pressure ulcer. And the tunneling is the narrow pathways that branches off from the actual pressure ulcer. Now, in your book on page 933, it shows you the suspected feet tissue and what you should look for and what it looks like. It shows you the stage 1, shows you stage 2, and then on the next page you're going to see the stage 3 and 4, also with the tunneling, and then you're going to see your unstageable, which is the actual eschar buildup on the actual pressure ulcer.